Okay, time for a quick refresher on test report interpretation and how you document recommendations to providers. Wait! Hit the pause button now and get a copy of the sample report in front of you before you continue. The first page of the report contains a list of medications that were listed on the rec form and the impact of the patient's genetics on them. Colored icons give you clues as to their level of risk. You can see that the red and yellow icons might suggest changes are necessary. But what would you recommend? Our report makes that easy. The middle section of the report contains a comprehensive table of commonly prescribed medications categorized by drug class. So if your patient's getting low pressure, which is in the red column, you might instead suggest Inderal because it's in the green column. It's that easy. I can hear what you're thinking. What documentation is there to support my recommendation? Well, that's easy again. In the latter section of the report, you find the drugs listed in the yellow and red columns in alphabetical order. Just find your drug, highlight or cut and paste the information, and add it to your communication to the doctor. Macros have been constructed in our expertise to make this easy for you. The evidence level you see there is pulled directly from PharmGKB references that give us the current level of clinical evidence available to support the conclusion. Actionable is the highest. And just because it says informative doesn't mean that it is necessarily unreliable. There are usually significant levels of support for this recommendation, but the benchmark actionable is set pretty high, as you might expect. Remember, this is a clinical decision support tool. It's our job to give the prescriber the most information we can gather to help them make a good choice.
That's all, folks.